Slides.
Thank you. So good morning, all of you, and thank you so much again for giving the opportunity to have an interaction with you all people. And it's really been very nice have a pre-test session. Dr. Vivekanshu has prepared a very good and even a few things I come to know from the mythology point of view today only. So thank you so much for enlightening us for this kind of pre-test preparations. So today, next half an hour, just I would like to focus on that how the scorpion stings. I've got an antemortem presentation or the postmortem presentations, and with this we'll start. So all we just have a few introduction that there are more than 1250 species of scorpions and about 100 of species are found in India. We all know the scorpions are 8-legged arthropods and have a hollow stings in the last joint of the tail. And regarding the venom is again a very, you can say, that clear colorless toxalbumen and can be classified as either neurotoxic or haemolytic. We will see that in detail. But the toxicity is again more than the snake, but only the small quantity is injected in this scorpion bite, scorpion stings. And venom is very potent autonomic stimulator, resulting in the release of massive amount of catecholamines. We will see that how this catecholamines is going to be released. Mortality again is there, but except in children, which is negligible. Here I would like to say that this is, estimated annual global incidence of the scorpion envenoming is about 1.5 million. And that is again a big number and are resulting in a 2,600 deaths also. There are 19 known families of the scorpions and more than 2,200 species. Out of that, 50 of the family, they are harmful to the humans. This is what the scorpion venom actually contains. We just have an highlighting on that point of view so that we can understand how that presents antemortem or the clinically. This is a proteinaceous components and non-proteinaceous components. Non-proteinaceous, we all know that maybe the water or mucosa or nucleotides, mucopolysaccharides, lipids, maybe any inorganic compounds. But in the proteinaceous compounds, most commonly or most importantly, that proteins and the peptides. So the proteins and how that protein is going to be affected us, that we have to understand, and that's why we have to understand the presentation also. Hyaluronidase, metalloproteinase, mucoproteinase, phospholipase, and serine proteinase. So we will understand how that is going to produce the clinical features or the presentations. Again, that is a life-threatening emergency and can cause serious health problems. So we don't have to take it very lightly. We don't have to take it very lightly when if it is confirmed that the scorpion bites or maybe a something bites which is not known to us. Clinical manifestations of predominantly again with the two systems, sympathetic and parasympathetic systems, and all depend on scorpion species. So here the systemic effects, we will see that how systemic effect is going to be produced and how that is going to be affected depends on the species involved and cause a variety of excitatory neurotoxins. If I am talking about some of the data from the published material that regarding the anatomical site affected by the scorpion sting, the percentage of the lower limb involvement is ranges from the 15 to 60.4%, while the upper limb involvement is varied from 12 to 73%. In short, that periphery of the body is still most or commonly affected body part in the scorpion stings. Here, this is going to be a very important clinical presentations as per the scorpion sting point of view concern. We can classify it into the three important matter, that is a mild, moderate, or the severe presentations. So if we can have a presentations of a local pain, erythema, edema, sweating, tremors, and agitations. So here that may be a very mild presentations of the scorpion sting. If the patient may have got a high temperature, the fever, the nausea with vomiting, abdominal pain, even the joint pains, rapid breathing, Hyperglycemia, that is going to be a very important finding. I will also share the one of the good slides on hyperglycemia. And tachycardia, that increase in the heart rate, that maybe comes under the moderate. So mild symptoms plus moderate, that may be a moderate, mild to moderate presentations. Mental confusions, if the patients may have got acute peptic ulcers, gastrointestinal complications, we will see that how the gastrointestinal complications develop. Hypertensive encephalopathy, muscular convulsions, arrhythmias. I just remember one child when we have treated that child, even though we were not sure, and that child was presented with us with a history of something bite, and we were also not sure of that point of view, but that was around 10 or 12-year-old child, and he presented with the convulsions. So we just assume that maybe a scorpion sting or something, but till the discharge of that child, we were not sure, even the patient or the relatives were not sure that scorpion sting was there, because there was no mark particularly on the body part. But he presented, he just remembered that something bites, and after that he presented with the convulsions. So that might be, the severe presentations like muscular convulsions. Maybe you can see some of the patients on arrhythmia on the ECG findings, maybe having a congestive heart failure, myocardial failure, maybe on a pulmonary edema, pancreatitis again, because sometimes we are not sure about the amylase functions and we are not going routinely for this kind of testing on admissions. So severe pancreatitis, multiple organ failure, or the coma. So in short, this is a very important for understanding for us, that the patients in clinical setting might be present with the mild, moderate, or the severe consequences after something bite. If they are not sure, if they have not seen anything, whether it is of snake or whether it is of scorpion or something, then we have to assume. Just few days back also, I just share one case report in our IST group, that that lady was having something bite on the arm, on the outer aspect of the arm, and after that she was become quadriparesis, ptosis, and all these things. So I was suspected the crate venom, but on a same day that she was having a severe myocarditis, the ejection fraction was only 30%. So that was again, creating a doubt on a clinical setup that might be a something which is a scorpion sting, because even in the snake bites, on the first day, it has really been very, very rare presentations of a multiple system involvement. Like this myocarditis, that lady has to put on ventilator for at least for 4 days. Just yesterday, we have Venom of her from the ventilator. She is quite conscious, but still her ejection fraction is 30 or 32%. So still I am on, just thinking on that aspect also, that might be a scorpion sting, but still we are not sure, because we were just having this kind of presentation. Also sometimes the crate presentations, but very rarely on this kind of myocarditis. So we have to be very careful while having this kind of presentations during our emergency setup. This is one of the photograph where you can see the blister on a scorpion, and that is the maybe sometimes the presentation signs on the stings. This is going to be a very important understanding that this is on the peripheral nervous system. If you can see, this is very much neurotoxic point of view, that presynaptic, here the scorpion venom is going to be affected. So that is going to be act on the voltage dependent sodium, potassium, and calcium channel. And that's why this is going to be called the spontaneous depolarizations. And that's why they got a repetitive this kind of depolarizations, and all the signs and symptoms neurological due to this presynaptic act of this scorpion stings. Another important mechanism of developing this kind of signs and symptoms, that may be a scorpion venom or the neurotoxins, that is here. If you can see the interleukins, all the interleukins is going to be inflammatory markers is going to be released, like IL-6 or IL-1, that will be act, and that may cause acute phase proteins released, bradykinin from the endothelial cells, We can have a neutrophils, eosinophils, and lymphocytes that may also reacted, and that ultimately from the leukocytes, and that lymphocytes also activated, and that may cause this kind of lipid mediators, histamine or proteinase release also. So this is all the related to this here, the complement system activations. So that's why what happened ultimately, we will see also that might be patients admitted in emergency, maybe of a multi-organ failure with this kind of acute storm of this kind of cytochrome, and maybe they may have this ion channels also. We will see that how that as the catecholamines or the acetylcholinesterase on the post-synaptics, they may have got this modulation of neuroimmune response also. So we have to understand the basics of this interleukins, how that is going to be affected. So in short, this is a cytokine labels. If you can have this venom or the scorpion stings, that may have got a, if the cytokines level is really be on a downside, that is a pain, swelling, or salivations or the local symptoms. But if it is once that cytokines is going to be increased, that may cause tissue damage, gastric or pancreatic or intestinal motility, as I talked with you. Maybe the patients manifested as organ dysfunctions, as I told you, that may be a lung edema, because that may be a highest level of cytokines. And ultimately, the patients went into the circulatory failure shock. So ultimately, that we have to understand the patient presented with the cytokines level, how that is presented. Another very important here, you can see the immune response activation, cytokine productions. The same things like interleukin 1, TNF, the tumor necrosis factor alpha, IL-6, where the production of lipid mediators and their proteolytic enzymes and that reactive auxin species, and that is activations on the endothelial cells and hypothalamus. The same thing like chemokines, anti-inflammatory cytokines, and Th2 cytokines. Ultimately, that all effects leads to the multi-organ failure on presentations. How many a times, as I told you, the many patients presented with the scorpion stings with the myocardial failure or the myocarditis. The reason behind that, the decreased insulin secretions plus associated metabolic defects that may be presented with metabolic acidosis also. Because as I told you earlier also, that oxygen, that anaerobic metabolism happens and the oxygen supply is going to be reduced down, and that patient may have got severe metabolic acidosis or metabolic defects. We have to go for the ABG corrections at that point. Catecholamine release also, as we have seen, and increased angiotensin 2 levels. This all together can lead to the myocardial failure, and other features of myocarditis may be seen on ECG. I will show you that. So in short, this is a toxins and mediators from the scorpion stings that may cause autonomic dysregulations, direct toxicity also, inflammations, or the coagulation activations. Ultimately, that will affect different organs on the presentations. Maybe patient presented with the myocarditis, arrhythmias, or cardiogenic shock, or maybe the heart failure, maybe having a bronchospasms or atelectasis, maybe having an acute respiratory distress syndrome, pulmonary edema, or respiratory failure. Maybe many times, I still remember one patient who I got a history of something by it and presented with a stroke. So that patient was not seen by me, but that was only the telephonically talk when we received the call from some periphery. And they said the patient have got something by it, they don't have seen anything, but the patient presented with the stroke, an ischemic stroke. So that may be some hemorrhagic there, or cerebral edema or seizures presentations, neuromuscular activation syndromes, myelitis, paralysis, or abdominal muscular movements. Maybe on a kidney point of view, that acute kidney injuries may be there. This is a very good slides. If it is little bit blurred, sorry for that, because I have taken it from the Pediatric Association, and it is going to be very good slide presentation. If you can see that from the first 0 over on the immediately presentation, the extreme local pain, maybe having a mild local pain, paresthesia, vomiting or salivation, sweating due to the hypovolemia, and ultimately, peripheral cool limbs will be there. But once that, if it is of mild, then no progressions, but the moderate one, that may even within 4 hours, the progressions may go into the autonomic strome. As I told you and described, that all the inflammatory markers going to be increased. So the patients or the pediatric populations, mostly they have been tachycardia, hypertensions, myocardial dysfunctions, arrhythmia, pulmonary edema, that may be hypokinetic phase, and here the inotropic phase. So within 48 hours, this picture totally been different if we are not going to treat this kind of scorpion stings on time. And if it is given severity, that maybe patients may have got encephalopathy, convulsions, aphasia, hemiplegia, or cerebral hemorrhage, DIC also, or respiratory failure. So ultimately, that all depends on the presentations. If we are not suspected this kind of scorpion stings on time, then that may be a difficult for identifications, and ultimately failure of identification of this kind of patients may lead to the strome and ultimately the death of the patients. Here, this is a sting, if you can see, and this is one of the photograph where a little bit finding on a scorpion sting marks. Another important, findings in a scorpion sting, that is, and that Bahule and et al. That revealed the T wave changes. Sinus tachycardia is there, but the T wave changes were observed in 90% of patients, but most of the other patients may be also showing that ST segment depressions or elevations. So that is also one of the things that we can look after in ECG findings where the myocardial involvement is there. Another identifications point of view on antemortem, we can ask the history that, that reported in the hospital admissions that maybe a color of the scorpions, as Dr. Vivekanshu has a pre-test we did, and based on that. Also, another important finding on the antemortem point of view, the hemoglobinuria. That is considered the most important examinations following that victims during the recovery period also. So as I told you, many patients sometimes presented with the stroke. So again, the most important mechanism again for the stroke, almost like maybe presented with the ischemic or hemorrhagic stroke, or there may be the reasons will remain the same, the inflammatory markers or the endothelial or neopeptide activations, the cardiac compromise that may lead to the arrhythmias and cardiogenic shock, and ultimately that embolus or thrombus may lead to the ischemic stroke. Coagulation disorders that may again lead to the thrombus and bleeding and lead to the ischemic or hemorrhagic shock. Again, the sodium potassium channels disturbances may cause catecholamines increase, and that lead to the hemorrhagic or the autonomic dysfunctions. Serotonin and histamine glutamate release, again that lead to the neurotoxicity, and that may lead to the ischemic hemorrhagic stroke, edema, seizures, or autonomic dysfunction or neuromuscular compromise. So my message to you people that if any persons presented with something bites with a stroke, we highly suspect of scorpion toxins or the scorpion stings at that point. That may be another study been revealed that the liver functions also on a higher side, and the glucose level also on a higher side on admissions, which is very important. Come to the autopsy point of view. The postmortem diagnosis, again, very without a history, has really been very challenging task, and that's why we have to send all the histopathological organs when we are suspected any unknown insect bites. Autopsy and external findings and internal findings, we will see all these things, but the internal findings are very important thing, the lungs, which may show the congestion and alveolar edema with the histological features of ARDS, that is of hyaline membranes. We can see the atelectasis, infiltrate of the morphonuclear common in the early stage of ARDS, and most of the cases they may have got edema or another things. Another cause of death in case of an allergenic proteins that may provoke the anaphylactic shock, and that lead to the hypotensions and vasodilatations, and ultimately that may cause ischemia and heart failure. Scorpion sting, as I told you, that may also act on angiotensin converting enzyme, that may accumulation of bradykinin, and that may lead to the pulmonary edema, and that is the main cause of the death also. But non-cardiogenic pulmonary edema is a disease process that may due to the hypoxia secondary to the rapid deterioration of respiratory status in scorpion stings. So acute pulmonary edema, that is also very important due to this we can have a granular or pale eosinophilic like this. If you can see, this is an infiltration of the cardiomyocytes with the, you can say, myocytolysis suggestive of myocarditis with the autopsy findings. Here you can see the lungs with the showing the alveoli filled with the fluid suggestive of pulmonary edema. That is a corroborative evidence of the scorpion stings. Kidneys also showing that necrosis. If you can see this, the necrosis of the tubular epithelium, which is again a very important corroborative evidence. When we don't have got any FSL findings, so the forensic science laboratory, we can have this histopathological findings and our old virtual autopsy findings that we can combine together and we can give the cause of death accordingly. So in short, if we can have this kind of death point of view, we can suspect the release of allergic proteins which can lead to the anaphylactic shock and ultimately the death. If it is on cholinergic syndrome, may can have a cardiovascular toxicity, they may lead to the heart failure and ultimately the death. Adrenergic storm, again, that can lead to the cardiovascular or the respiratory failure and ultimately the death. And neuromuscular excitations ultimately lead to the respiratory failure and the death of the person. So depending on the presentations, the history on the hospital, and after that on the postmortem findings, we are able to understand how the scorpion stings presents and how that works. So on autopsy findings in a case of fatal scorpion sting are well not described in the literature. Only a few case reports still available, but still we can have a frequent finding of pulmonary edema or ARDS. Impairment of the respiratory functions can be that secondary or the cardiac one. So that's why it is very important we can have an histological or immunohistochemical examinations for this type of death in order to better understand the pathophysiological mechanisms underlying them. And finally, the large number of scorpion stings worldwide is concerning and reaffirms the need of the prevention measures, and that's why the policies to reduce the incidence and relevance, morbidity and mortality rates from this poisonous orchids. So I think I have just tried to cover the antemortem and the postmortem ones. Maybe a few of the slides, maybe that overlap with the other, but we'll try to stuck up with these two important things. Hopefully that will be suffice the session. I think if you got any questions, doubt, I think we'll take it later on. Thank you so much.
Thank you, sir, for the very nice presentation. It was an interactive session for all of us. And you were able to actually relate with what the practical difficulties the doctors face with the systemic envenomation which occurs in cases of scorpion stings. So we will now to the next session. So we would like to invite Dr. Chidrupi ma'am, who is will be present, who is right now the director of the Freedom Clinics, and she's an emergency physician.